Good evening, doctors. Welcome again. Today we are going to discuss here about evidence-based study tips. First point is study smart, not long. Focus on active recall and not simply reading notes or books. This is recognition. Okay? First tip. Second tip. Paste color label on side of 200-page notebooks for each subject such as anatomy, biochemistry, physiology so that you can stack all of them together easily. List content on cover. Make one line keywords for each chapter on separate color sheet subject wise. At the end of medical school, for instance, you will have only 20-25 sheets. For entire period of study for quick revision, load them. 3 list all topics the professor will cover in a subject. That a Google spreadsheet, Excel. Mark the various colors you finished them. First review, second review, third review. Before exam, each time you recall the points in the topic studying you book does not qualify for this enter date. Next time you read it, mark. Third time in color code these dates as how well you recall. Easy green, medium orange, hard red to get instant picture of your week. Focus on high yield material and books for medicine. 4 types of books reference. Books for further study, standard books for daily studies, review books for exams and question bank for MCQs. Use just one study book and one question bank. Concentrate first on what your professor teach. They have read all the important books and their questions will be from the material. They teach if the professor says this is important, pay attention. Attend all classes and especially practicals. Use mnemonics, vulgar sentences and images to improve recall. Doctors remember the vagal cranial nerve mnemonic even after 30-40 years. Use mental and physical pictures, mind maps, memory places as a technique of memorization. Ancient Greek, Romans, and Indians memorized large texts this way for centuries. Use cartoons, mnemonic, and sketchy medicine. The more bizarre, the better. Sing medical songs or set to popular tunes, chants, slogs, many medical songs on YouTube. Ancient cultures transmitted information orally through chanting. If you want to remember something recalled well, write down key points and read it 15 times just before going to bed and 15 times within first 5 minutes of waking up. Google the topic punch words which you differ for each subject. These 10-15 punch words for each subjects are high yield and all questions are set of these. Example, you can't complete Harrison medicine in your entire life, but in electronic form if you Google the drug of choice, it will list 200 of them. Do it all subject. Punch word for anatomy are different from punch words physiology. Use Pomodoro technique for study. Buy small alarm clock, not phone alarm. Study in 25-minute blocks. Then do anything else for 5 minutes. Do it again after 2 hours. Take a 30 minutes break. Reward yourself. Try to study with a friend or two, not more than 4 people in a group. Always get 7-9 hours of sleep daily. Try to sleep 10 pm and wake up at 5. No wonder military institutions worldwide do that. Immediately study for an hour, then exercise vigorously. There is more ATP in the morning and by the end of day, more adenosine, more ATP, better study, sleep and it help convert it back to ATP. Most medical students stay awake at night, sleep for 4-5 hours, wake up 15 minutes before class and run there unbathed. Watch videos on subject previous night, review in morning, scan textbooks, chapters, heads, subheads, and bold type points, picture tables, and most important, the question at back of chapter. Then attend lecture at home, read textbook and question bank. Spaced repetition, read then reread next day. Read-made decks are available for each subject, but it is better to make your own decks. Put sticky notes, also called post-it notes, above your desk. Every topic, scan them for 15 minutes daily. By the end of the year, you would have seen them hundreds of times, somewhat while doing the task. Practice testing yourself is a great technique. Research shows instead of writing point-wise summary of the lesson, make questions to cover the topic. Practice active recall. Do not open your textbook or notebook after listening to a lecture. Instead, make notes by recalling as much as possible. Check the textbook and list in another color all the points you forgot. Focus on them repeatedly by adding it. Most students think reading books or class notes is studying. Reading a lesson is only passive recognition. It is useless. Instead, focus on active recall and spaced repetition. Recall the points in the topic. That is why teaching it to someone without using notes is the best form of active recall. Else stand, don't sit and lecture to empty room. Use drawings, write points and blackboard, whiteboard and especially gesture. Improve recall. Keep a whiteboard in your room. Try to dramatize the situation. Can you make a skit of the topic like an action potential running down the stairs? Iron channels consisting of student opening closing. Daily, even while walking to class or while waiting to next patient, you can scan two cards in 10 seconds. Make desk with fill in the blanks card. Add illustration cartoons in extra cool. Make color desks to must know, desirable to new, revise must know more often based on school syllabus that professor will give you in the detail. Try to practice as many past question papers as possible, even several times. Focus on learning the concept rather than memorizing things. Make most notes with pictures rather the word exam increasingly photo based. More draw, more will. Spanish neuroscientist Santiago Raman Casal drew a complex neuron from memory Google. If studying 5 or 6 topics in one session, don't study one after the other. Do topic 1 and 2, then test yourself by recalling topic 1. After studying topic 3, test on topic 2. Do same with the rest. While studying several subjects at the night, jump from one subject to another and come back to any of them at any point rather than doing it sequentially. Example, anatomy, physio, biochemistry. Don't study one by one. Study a little in each and come back to do other chapters in each. At the end of the day, write out plan for tomorrow. Before sleeping, mentally review what did you study today. At the end of the day, write out plan for tomorrow. Before sleeping, mentally review what did you study today. Studying daily for 1 hour over a week is better than studying the whole thing in a 7 hours in a one day. Just before exam, sleep rather than study. If you study without sleeping, you will not remember what you studied. During exam, stop every 30 minutes and take 3 breaths of 4-second inhalation, 7-second hold and 8-second exhalation. Sure, you could have answered a few questions in those 57 seconds, but did you get them right? Doing this exercise will boost oxygen level and make you more alert to tackle the other questions correctly. Focus on quantity of topics, recall than quality. Concentrate on studying and recalling areas you are poor in rather than rereading stuff you are good at in the revision period before exams. Read red chapter more than the green ones, which you have already. Do 10-year test papers if possible repeatedly under test condition. Spend maximum time in practicals and clinics. Recall, try to do as much dissection as possible. After a few months, most students are watching their phones and not dissecting. What that is your chance. Size the opportunity. Volunteer as much as possible to dissect only those who become good surgeons. Watch videos of candidates who stood first in various medical exams and learn from them. Spend weekends and holidays and whenever possible helping and meeting people and listening to their stories in the cancer ward. Old age homes, schools for children with special need, work with physically and mentally handicapped people. Be empathetic, never be arrogant. Everyone is a teacher. Nurses have a lot of experience as they spend more time with patients, unlike doctor. Ask them for suggestions, learn from them. Be extra cautious to nurses. Ask seniors and professors for tips. Ask them about their interesting cases. Talk to a lot of people. Listen to patients without interrupting them or getting impatient. If you listen long enough, you will know the case correctly. Let them talk without interruption. Don't focus on money in life. This is important. Don't focus on money in life. Don't be greedy and seek commissions or do unethical things. Even if others are doing it, prescribe cheaper drugs, read inspirational articles about doctors who went out of the way to serve people, often getting no money. Please try to help poor and write cheaper drugs for poor patients, especially poor patients. Those who can afford, you can write expensive. Really focus on improving your handwriting. Nearly every doctor has terrible handwriting. Many drugs have similar names with only one letter different. Sleep early and for 6-8 hours daily. Exercise vigorously. Do pranayama and meditation. Write a daily journal. List 3 things you are grateful for. Study Monday to Saturday like hell and totally enjoy on Sundays. Go crazy on Sunday and really have a good time in your hobbies. So guys, I hope these studies will help you in future. If you follow these evidence-based study in your life, you are going to become a excellent doctor and a very good human being. So guys, thank you. Good day. Goodbye. That's all for today. Goodbye. If somebody is new on my channel, please subscribe it. And if you like my videos, put like.